first, help us explain what happened this week.
What happened?
What happened and why?
Unbelievable.
And what happens now?
They pulled the bill.
Yep.
But as we all recognize, this process is fluid. There's a lot going on. I'm 100% committed to getting this bill up for consideration on the floor, passed out of the House, and ultimately onto the President's desk. And really proud of the work that has been done around this legislation. It passed out of committee unanimously, Energy and Commerce Committee. I'm proud to chair this committee, and this committee has a rich history of really, I call it plowing the hard ground necessary to legislate, and that's what we've done on this bill. And you heard it's an important first step. I agree with that characterization, but I believe this is a very important first step when we talk about price transparency. We've worked hard with the Ways and Means Committee, the Ed and Workforce Committee. We're working with leadership to get this bill out of the House, and I also am really grateful to Ranking Member Pallone for his work and partnership in bringing the bill this far, and we're committed to getting it done.
There's sort of, you could look at it glass half full, glass half empty in terms of Congress. Like you said, it's rare to have this strong bipartisan support. It's rare for the committees to agree on their jurisdictional issues. But Congress is obviously struggling on many things right now. And so, in addition, are you getting any pushback? We know that hospitals are often the biggest employers in almost every congressional district. They have a lot of influence. As we just heard, they are against this. Are you getting members who are nervous, and what are you telling them?
Well, hospitals are very important, and in every community, in my district, in rural areas, underserved areas, absolutely hospitals are important. I have a champion, though, hospital in my district that has embraced this, working with local employers and really looking at how can reimbursements be targeted to make sure that we're driving down cost for seniors, for patients. That is our goal, is to really get price transparency within the healthcare system, whether it's hospitals, health plans, health insurance plans, PBMs. That price transparency is really important to accountability and ultimately to empowering patients and doctors to be making these decisions. We hear the stories so often of whether it's a medical billing error, but it's not like a rounding error. There's I know one story where the lady was it wasn't a rounding error, it was $11,000, right? Or just because of where the procedure takes place, it could be the same doctor, same procedure, but if the hospital buys out that facility, then you go from like a sterile injection, it goes from or steroid injection, it goes from $30 to $350. Mm-hmm.
And so, if you had one of your members come up to you and say, hey, I'm getting the hospital in my district is telling us this will ruin them, I'm nervous about voting for it, what would you tell them?
Well, we're continuing to work with everyone on this legislation, continuing to work with the hospitals. What we believe is that it's very important that, well, first of all, this is a 95% positive issue that people, when they hear about price transparency for healthcare, they support it. They believe that it's needed. 100 million Americans are carrying medical debt, so getting these prices is really important. We want to continue working with the hospitals, and in this bill, we take action to support the safety net hospitals to make sure that the reimbursements are targeted. But this idea that we're just going to continue to support hospital systems that have become very large and oftentimes opaque and a lot of consolidation with prices going up for seniors versus a more targeted, transparent approach to reimbursements. I believe that in the end, if we continue to focus on transparency, accountability, and a targeted reimbursements, really making sure that we're reimbursing for the right things at the right cost, and helping hospitals, because they are very important, that's going to be more effective.
Mm. And we know that what ultimately made it into the bill is not everything that folks want to see on this front. What didn't make it in that you do want Congress to tackle eventually?
Well, one of the big issues and the reason that the ranking or some of the Democrats are not supporting it is the transparency around ownership of different
the private equity.
Private equity, right? And what we did get was Health and Human Services is going to do a report on consolidation, which I know it's not everything, but I do think that is going to help inform our efforts moving forward and is very important. In negotiation, nobody gets everything that they want, but I'm really proud and encouraged by the work that has been done by 3 standing committees as well as 40 plus members that have provisions that are in this bill.
And are you hopeful for a vote, by the end of the fiscal year, by the end of the calendar year?
Today.
Yeah? Really?
Well, hope rings eternal.
News, guys.
So I'm hoping for a vote as soon as possible in the House. I believe that this legislation has, we've done a ton of work over several months, and I'm anxious for the vote to take place in the House and working hard to encourage leadership to bring it up for a vote. And we'll continue to have conversations with my Senate colleagues and with the White House to ultimately get this legislation onto the president's desk. Yes, by the end of the year.
We know that the hospital industry is really, pushing back hard on this. There's going to be ads. People are going to be seeing these messages. And so, what do you want folks to keep in mind when they're seeing, when they're reading an article on Politico and an ad pops up?
Well, maybe one of my colleagues said it best when I was talking to him about it recently. He said, in America, we know the price for everything that we buy. And as consumers, we're able to go out and make decisions, make those valued decisions based upon what the prices are. And in healthcare, we need that too. We need as individuals to be empowered with the prices, and that's one of the best things that we could do to really bring back the decision making to the patient and the doctor, which is my goal in this huge healthcare system, and to also really get to the core issues of what's driving the cost of healthcare. We continue to see healthcare costs increasing, and we need to address what's driving the cost of healthcare. We've seen a lot of consolidation. It's not bringing down the cost of healthcare. So this is a very important first step to really look at how we address the rising cost of healthcare and make sure that we're protecting the decision making between the patient and the doctor.
And just quickly, in the remaining time we have, we know, past policies to try to push hospital price transparency have run into some trouble. There's been some compliance issues, and in terms of requiring price disclosures, and also sometimes just seeing those costs doesn't translate to what patients actually pay, and so it's sort of hard to interpret for the average person. So how do you hope to sort of get past those challenges?
Well, because of the work that has been done on price transparency, and yes, we do need to, that's why this legislation, part of the reason this legislation is important is so that we have data that can be used most effectively, and the continued focus on making sure that that the hospitals and others in this legislation, the health insurance companies, the PBMs, are also in compliance. But we also have more stories because of price transparency today of individuals, employers that are making decisions that are benefiting the seniors, the individuals, bringing down the actual costs that they're having to pay out of pocket and as employers for healthcare. I have employers in my district, but there's others around the country that are also seeing those savings because they're able to make a value-based decision, but also based on the price.